Hi, good evening. My name is Judy, and I'm here to discuss and answer the questions provided on the video about the patient with the PID. So, PID is pelvic inflammatory disease. So, PID is commonly caused by an infection or an untreated infection within the female's reproductive area. So, the first question is what lab results are expected to find on the patient with PID. So first is there would be a blood test. The blood test will probably show an increase of WBC or the leukocytes, because our WBC are responsible for fighting infections, especially the neutrophils, because the neutrophils are the first line of defense to fight the infection. So there would be an increase of that. There would also be the culture, the swab, to which determines the specific causative agent that caused the infection. And some causative agents are the most common are the gonorrhea and the trachomatis. Yes, and there would also probably be electrolyte imbalance due to the dehydration, because the patient said that she hasn't had anything to drink for the last 24 hours because of nausea and vomiting. And vomiting too causes dehydration and electrolyte imbalance. So, yes. Yes. So the next is, what informations are important to gather for our patients? So important informations include for the pain, for the complaints of pain. Of course, we have to question more or further questions regarding the pain. If the patient has had any medications, if she took any medications to help with the symptoms, or when was the last bladder movement the patient, and how much it is, and also the vaginal discharge, how much, and bleeding, how much it is, how the amount of the bleeding. And for the vaginal discharge, we ask about the color, consistency, if there's a pus or if there's like a very pungent odor, amount and consistency. So that, and also we will ask for histories of pregnancy termination, recent sexual intercourse, or if the sexual intercourse was painful, childbirth, because or pelvic surgery, because those types of procedures could also cause an injury to that reproductive area. Also, we will ask if she noticed, if the partner, if they had an intercourse, if the partner had an infection or things like that, because it could have been transferred to her. Multiple partners would increase risk for sexually transmitted disease or infection, and then she had that. Also, you need to check for allergies, because the patient will definitely get some medications, and we need to make sure that these medication will not cause some allergic reaction or hypersensitivity. Also, if the patient have a history of alcohol, because it's been said that use of alcohol can depress or CNS, and we can have some bad decisions, such as, we like a intercourse with a stranger, and then you don't know that stranger, and then that stranger had infection and it transferred to you. So like that. And if the patient had or has an IUD, because IUD will be inserted into the vaginal area, so that could also potentially cause an injury to that area. What else? Yes. So the next thing is, what are the important interventions that we should include to the patient? So first, obviously, is we provide fluid and electrolytes because the patient is dehydrated due to that bleeding, nausea, and vomiting, and not having had anything to eat and drink, and that. And we will also give the ordered medications for the patient, pain medications. She would probably have a broad spectrum antibiotic ordered if there's no result of specific infectious and causative agent, like the type of infection it is. So, in that. Also, we would take vitals, obviously, and also we will provide some non-pharmacological interventions for the pain, such as positioning and maybe distraction, music therapy to kind of help with that, maybe distract from the pain. Also, hygiene is very important because that would decrease the risk for infection. So if the patient will have pain, like when she goes to the bathroom and it's painful to wipe in that area, we could have the patient use a sitz bath, where the patient will have to sit on a container, and that container has like water, some cleansing agent that will kind of clean that area. So instead of wiping, the water will do the cleaning. And then positioning. If the patient has some remaining discharge, high Fowler would help. The gravity would pull out those remaining discharges. So that would help. Yes. So we would also recommend that the patient's partner will be also tested, because maybe the infection spread to the partner, or the partner gave that infection to the patient. Also, we educate the patient to abstain or avoid sex for 3 weeks, to kind of give time for that vaginal area to decrease the inflammation and help, which would definitely help with the pain too. Also, we encourage the patient to have a monogamous relationship to avoid or decrease the risk of getting an STI. We would also educate the patient to continue with having some fluids to help with the dehydration. We would tell the patient to proper hygiene, to decrease risk of infection, and to call the healthcare provider when the patient is discharged. We will educate the patient to call the doctor if there would be another unusual vaginal discharge. Because if the patient has an infection and an infection left untreated will cause more problems, cause infertility and other damage to other areas because of the infection. Also, for the antibiotic, it's very important that the patient will follow through and complete the whole course of that medication. If there would be, or if there is a skin tear on that area or injury, wound care is, we would teach them about wound care, to keep it clean, moist, and that. And also, we would provide emotional support to kind of encourage the patient to talk about their feelings, what they feel about her condition and her concerns. And so we could try to provide education or give answers to some of the questions. We could also provide a referral to for counseling if the patient would like it or would need it. Also, we provide education on some sexual barriers that the patient could use to decrease risk of transmitted diseases or infection, such as use of condoms or some other barriers, oral barriers, and things like that. So, what else? That'd be it. So yes.